Welcome to this educational video produced by Wessex Local Medical Committees, supporting you to support your practice. This update will last for about 10 minutes and is aimed at clinicians working in primary care. This is the first in a series focused on cancer, and we'll look at the common cancers that GPs will see and also look at cancers with the worst survival rates. Much of the information in this video is taken from Cancer Research UK and the Macmillan Cancer Support websites. Cancer is responsible for about 28% of all deaths in the UK, and about 360,000 people are diagnosed with cancer every year, and around 165,000 cancer deaths occur per year. About 50% of the population will develop cancer at some time during their lifetime. Cancer survival rates have doubled in the last 40 years, and now over 50% of people will survive their cancers. But more can and needs to be done in the UK, which still lags behind some of the other European countries in terms of outcomes. So what do you think are the 5 most common cancers in the UK? Well, breast, prostate, bowel and lung cancer account for more than half of all cancer presentations. The survival rate for each of these cancers is different and is often dependent at the stage at which it is diagnosed. The diagnosis at stage 1 or 2 often having the best prognosis, and those at stage 4 generally have the worst. Breast is the most common cancer, with 42,000 new cases per year, with 99% of these occurring in women, but it should not be forgotten that men can also develop breast cancer. About 20% of breast cancers occur in women aged 50 or under, and this is the most common cause of cancer deaths in women in this age group. Survival rates for breast cancer have doubled in the last 40 years, yet this remains the 4th most common cause of cancer deaths in the UK. Prostate cancer is the most common cancer seen in men and accounts for about 37,000 cases per year. About 1 in 8 men will develop cancer in their lifetime, and it mainly affects men aged over 50, and the risk increases with age. The risk is higher in certain ethnic groups and in those who have a brother or father with prostate cancer, so there is a genetic predisposition to this cancer. If you have a first-degree relative with prostate cancer, this will increase your risk by 2.5 times. Lung cancer accounts for about 13% of all cancers, with 36,000 new cases per year. But over 70% of these present at stage 3 and 4, and hence why the outcomes are poor for this cancer. Lung cancer will affect about 1 in 13 men and 1 in 15 women. And it's estimated that about 80% of lung cancers are preventable, as 70% of them are caused by smoking. Over the last 10 years, the mortality caused by lung cancer in men has decreased, but in women this has surprisingly increased, and it is thought that this is directly related to smoking trends. Melanomas account for about 13,000 new cases per year, but has one of the best survival rates as it's normally diagnosed at an early stage. This will affect about 1 in 36 males and 1 in 47 females at some time during their lifetime. It is thought about 85% of melanomas are preventable if people took greater care in the sun. Red-haired people are most at risk of developing melanomas, but they're also more common in fair-skinned people. Which do you think are the common cancers that you see in your surgery which have the worst 5-year survival rate? Well, these are lung, pancreas, liver, esophagus, and stomach. The majority of people who develop these cancers will be at stage 3 or 4 at presentation, and hence why they have the poorest outcomes. When one of our patients develops cancer, we will look back at previous consultations to see if we could have made the diagnosis earlier. Many will discuss such cases at significant event meetings with colleagues to see if any lessons can be learned. I'm sure, like me, you get fed up with headlines in the newspapers, such as the one that appeared in The Guardian in 2017, which stated that cancer symptoms were often missed by GPs. This was reporting a study analysing over 4,500 patients in 2010 who were diagnosed in A&E, and suggested that over 40% of these people had seen their GP 3 or more times before the diagnosis was made. I believe this is a gross misrepresentation of the challenges we face in general practice, both in terms of making an initial diagnosis and the complexities of patients with multiple symptoms, and the symptoms they present with are not always typical of cancer. As I said earlier in this video, there are about 360,000 people diagnosed with cancer every year, and more than 165,000 people who die of cancer in the UK per year, accounting for about 28% of all UK deaths. It is therefore not surprising that cancer is one of the major focus areas within NHS England's long-term plan. The one-year survival has increased from 62% in 2001 to 72.8% in 2016. The current 5-year survival rate for cancer in the UK is 59%. The NHS long-term plan ambition is that by 2028, that 75% of cancers will be diagnosed at stage 1 or 2, which will therefore improve the survival rate for many cancers, and this will mean that 55,000 people per year will survive their cancer for more than 5 years after diagnosis. The aim is to improve survival to compete with the best in Europe. If we're going to improve survival rates, we need to do a number of things. Prevention. We know that 4 in 10 cancers are preventable, but how do we change society in taking the appropriate action that is needed, particularly in terms of changing their lifestyles? Screening. How do we increase uptake, especially in the hard-to-reach groups, but also expand the screening program to other cancers such as lung cancer? Access to diagnostics are often a factor in the delay in diagnosis, so how can we improve access to appropriate investigations? You may not have heard of a rapid diagnostic service, but this is part of the long-term plan and is being developed by the cancer alliances and would be available to all areas for those patients who present with symptoms which may be suggestive of a cancer, or simply that GPs have a gut feeling that a cancer is causing the unexplained weight loss, high platelet count, abdominal pain, etc., but the patient doesn't fit with one of the current fast-track pathways. Better treatments, including the new area of genomics, will play a role in improving survival rates for the future. GPs look at significant events and learn from cancer audits that are undertaken in their own practice and across a larger geographical area. Therefore, continuing education and training plays an important part in ensuring that general practice is not only up to date with all the relevant developments, but is able to diagnose cancer at an earlier stage and improve outcomes. This video has been produced by Wessex Local Medical Committees. We hope that you've enjoyed the video and found it interesting and informative. The next video in this series will look in more detail about prevention and screening. Wessex LMCs supporting you and your practice. Thank you for watching this video.